If you've clicked this video, you've probably been having elbow pain for some time. You may have tried the usual patient care pathway, which is ignoring it, then eventually seeing someone for it, and then ultimately accepting it. Actually, that's wrong. If you've accepted it, you wouldn't be watching this video, so good on you for being persistent. Many practitioners will suggest various stretches or manual therapies as the solution to your elbow pain, and sometimes they're right. However, if you've been experiencing either tennis or golfer's elbow for a while now, these interventions alone probably won't be sufficient for you. In this video, we'll be covering why your elbow pain hasn't been getting better, as well as the solution to put you on the road to recovery for both new and old cases. Disclaimer time, which of course is mandatory anytime I'm talking about health on the internet. Every body is different, and therefore every body needs an individualized treatment plan. If you've injured your elbow or a tendon, the single best piece of advice that you will receive is to go see a registered healthcare provider whom you trust. If you disagree with what your practitioner is saying or they're not being particularly helpful, you have a right to as many other opinions as you could possibly want. To that end, if you think you have golfer's or tennis elbow, please go see a healthcare provider and use this video as a talking point, but do not rely solely on it or anything else you find on the internet as a means of self-diagnosis. Alright, that's done. Let's get started. As always, let's dive into the anatomy. Tennis and golfer's elbow refer to the lateral or outside and medial or inside aspects of the elbow respectively. For tennis elbow, also known as lateral epicondylitis, local inflammation is present at the common extensor tendon, which is the common site of insertion for all muscles that exist on the back of our forearm and connect to the back aspects of our hand. For golfer's elbow, the opposite is true. Also known as medial epicondylitis, there's local inflammation at the common flexor tendon, again located on the inside of the elbow, that connects all of the front forearm musculature. These muscles also go on to attach into the front aspects of our hand. Now, these particular injuries tend to start as overuse injuries, which are usually caused by repetitive movements of loading that are outside the tissue's ability to tolerate. Common culprits include any kind of activities that include a lot of repetitive wrist movement, things like tennis, golf, obviously, hence the names, certain trades, musicians, video gamers, carpenters, plumbers, electricians, anybody who works with their hands, really. Chiropractors too, believe it or not. The problem arises when the individual who is currently experiencing the beginning stages of these tendinopathies continues to push through the activity that is aggravating them. You'd think that the solution would be simple enough, stop and rest for a bit, but this is kind of hard to do when it's tied directly to the things that you love to do or your sport or your literal career. Because it can be difficult to take that period of rest, this will lead to a lot of people simply ignoring the pain and continuing to push through or suck it up. Unfortunately, doing nothing doesn't result in nothing changing, rather it can actually result in things getting worse. Inaction is an action, folks. Now, an important thing to note if you are a person who has been experiencing elbow pain for a long time now is the difference between tendinitis and tendinosis. They sound very similar, but there is a key difference. Both tennis and golfer's elbow begin as tendinitis or local inflammation in their respective structures. Continued aggravation of these structures results in chronic sustained levels of inflammation. This chronic exposure can eventually convert the condition from a tendinitis to a tendinosis. Tendinosis refers to a histological, which means at the cellular level, change within the structure of the tendons. These structural changes result in a tendon that is less strong, less functional, and overall more deranged. That's the actual term for it, deranged. Tendinosis is also independent of inflammation. You may have the inflammation completely clear up from that tendon, but the underlying structural pathology will continue to remain. And so would the functional deficits. Quick histology background, a healthy tendon is largely composed of type 1 collagen fibers, and type 3 collagen fibers are what they become in the case of a derangement or tendinosis. This transition from type 3 or deranged collagen fibers back to type 1 or orderly collagen fibers is what we're trying to do when we are resolving or fixing a tendinotic complaint. And unfortunately, that can take some time. Getting into the treatment plan, the best thing, and I've said this already in the disclaimer, that you can do if you are experiencing elbow pain is to get it examined early. Identifying causative agents in your work, hobby, or sport and modifying them to be non-aggravating can be absolutely key in preventing these from progressing to tendinotic complaints. Treatment plans for initial tendon pain are usually quite simple. They'll likely be a combination of a short initial rest period with ice, where the idea is to bring down inflammation and pain levels, followed up with manual therapy and some rehab as well. As far as manual therapy goes, instrument-assisted soft tissue therapy and some myofascial release technique or massage could be very effective, as well as acupuncture is quite effective in reducing pain in tendons too. Rehab-wise, certain stretches of the muscles can be beneficial, as well as exercise to improve the strength of those tendons on the spot. But these are probably the things that you have tried before with practitioners if you've been dealing with this for months and haven't seen much improvement. We'll be getting into what you should be doing if that's your case, but first let's just go over the baseline exercises. Tennis elbow affects the common extensor tendon, therefore extension-based exercises are what you should be doing if that's what you're dealing with. Reverse wrist curls with either a weighted dumbbell or resistance band, alongside finger extensions with perhaps increasing levels of rubber bands around your fingers, are good places to start. Conversely, golfer's elbow affects the common flexor tendon, so you will need to do flexion-based exercises. Wrist curls with a dumbbell or resistance band, as well as isometrics with a stress ball, could also be good places to start. 90% of new medial and lateral epicondylitis complaints will resolve within 3 months. However, if you're one of the 10% where this was not the case, what do you do? Well, the treatment plan looks very similar, however, we have to be a lot more intentional with our rehab. Specifically, we will need a progressive loading plan to gradually shift the structural integrity of those affected tendons back to something that resembles normal. We are no longer trying to reduce present inflammation, we are trying to restore tendon integrity through complete remodeling. Now, how do we do that? With both time and a gradually increasing progressive resistance training program. That's a lot of fancy buzzwords to basically say you're going to be lifting heavier as time goes on. Our tendons are highly relied upon for fast, explosive movements. These movements are referred to as plyometrics, and doing them at these early stages could be quite painful for you. Therefore, the proper way to load a tendinotic tendon is initially with heavier weight, but a much slower speed. You'll want to complete the following rehab plan 2 to 3 times a week. Begin with isometric exercises, which are movements that don't actually involve the length of the muscle changing, in order to decrease the pain perception that would normally be perceived on the following exercises. For golfer's elbow, once again use that stress ball, squeeze within 70 to 80% of your max for 45 seconds 5 times. For tennis elbow, you can resist your own wrist extension, again 70 to 80% as hard as you can for 5 sets, 45 seconds each. Yeah, 45 seconds. Following these warm-ups is the strengthening plan proper. Once again, depending on whether you are rehabbing the flexor tendon, which is golfer's elbow, or the extensor tendon, which is tennis elbow, you will be doing wrist curls or reverse wrist curls respectively. Complete each rep in a 3-1-3 format. That is 3 seconds to lift, 1 second pause, 3 seconds to lower. This time frame ensures that there isn't an excess plyometric force put through the tendon, and that it doesn't get overstressed during any of the movements. Off the start of this program, complete 15 sets 4 times with 2 minutes of rest between each. It's important that on the 15th rep, you feel like you would be unable to complete a 16th rep. If you still feel like you have a few in the tank, you need to increase the weight. Maintain this structure for the first week of your rehab. Again, remember 2 to 3 times a week. For the second and third week, increase the weight, but decrease the reps to 12. You shouldn't be able to complete a 13th rep. If you feel like you can, increase the weight a little further. For weeks 4 to 5, keep the structure the same, but increase the weight and decrease the reps to 10. For week 6 to 8, which is a 3-week period, not a 2-week period, further increase the weight and decrease the reps to 8. And finally, weeks 9 to 12, which is another 3-week period, increase the weight and decrease the reps to 6. The important thing that you will realize with this progressive rehab program is that it increases in intensity or weight as the structural integrity of your tendon is restored. As your tendon increases its load tolerance, so too must the load in order for it to further improve. This is why a lot of people who do have tendinosis may be given an initial rehab program, feel maybe 10 to 15% better, and then plateau out, never getting any more improvement. It's because they need to increase their load regularly. They need to do it regularly. Towards the end of this program, a very gradual return to sport or activity, or whatever the original aggravating factor was, could be considered. But of course, once again, every body is different, and that decision should be made alongside a registered healthcare provider. Again, as always, who you trust. Starting to feel like a bit of a broken record when I say these things, but it's important for repetition to drive home a point. And in line with every body being different, the listed structure of this rehab plan is appropriate to the general public. However, I still believe you should go consult with a healthcare provider who offers to treat you in a similar style. In summary, golfers and tennis elbow are initially tendinitis-related complaints that, if left unchecked, may progress into tendinosis. Tendinosis refers to the structural degradation separation of a tendon from organized collagen fibers into disorganized collagen fibers. The resulting degradation results in decreased functional ability. The method to restore proper integrity of a tendinotic tendon is through a structured progressive strengthening program, and the duration of this program may range from 3 to 6 months. That's all for today. Thank you so much for watching, guys. As always, if you have any questions, comments, concerns, please leave them in the comments down below, and I will do my best to respond to as many of them as I can. If you have a spare 3 seconds, please hit the subscribe button below. It helps me to pay taxes. This is the first year of my life that I've ever had to actually pay Canadian taxes. This sucks. You can click here for the previous video, or you can click here for the most recent one. Have yourselves fantastic days.